The Transitional Care Management Program at LVHN is aimed at reducing avoidable hospital readmissions. Our goal is to provide TCM services to support both quality reporting metrics and cost management strategies. It is estimated that approximately 12% of hospital readmissions are avoidable and could save the Medicare Trust Fund up to $1 billion per year. When patients are discharged, some may have follow-up outpatient diagnostic testing, and may also have home health or therapy services. It is likely that some patients may be started on new medications, such as warfarin. Patients may need education on dosing and administration of newly prescribed medications. TCM services are a key part of the patient moving smoothly from the hospital or institutional environment back to their home. Following a discharge from an acute care inpatient hospital, an inpatient psychiatric hospital, skilled nursing facility, partial hospitalization admission, or from an observation unit, patients returning to their home, to a rest home, or to an assisted living facility may qualify for TCM services. Unlike most other evaluation and management codes, TCM services encompass a period of time versus a single date of service. It's critical to remember when TCM begins and when it ends. TCM begins on the day of discharge, whether it's 9 a.m. or 8 p.m. That's day 1. TCM continues for 30 days and ends on day 30. That's the last day TCM services can be provided. Many healthcare providers already meeting the requirements to bill TCM miss deserved reimbursement because they lack documentation and billing information. In order to report TCM codes, it is important to keep several key elements in mind. The first element is an interactive contact with the patient. The patient needs to be contacted within 2 business days of their discharge date. Second element. Medications should be reconciled no later than the day of the face-to-face interaction with the patient. Depending on if new medication had been added to the patient's profile, or if there were dosage changes to existing medications, this will impact the type of medication reconciliation and education the patient and their caregiver may need. Third element. A face-to-face visit encounter with the physician or APC. The face-to-face visit with the patient must occur within 7 or 14 calendar days of discharge. Scheduling a patient within 7 days may not necessarily be due to medical necessity or severity of condition, but due to provider or patient request or concern. It may also enhance patient satisfaction when seen quickly by a provider. Many providers assume if the patient is seen within 7 days of discharge, they can bill TCM code 99496, high medical decision making. However, only those patient visits within 7 days which qualify for high medical complexity may be billed TCM code 99496. Most post-discharge TCM visits may not meet the high complexity guidelines. If a patient is seen within 14 days and meets the moderate complexity guidelines, a TCM code of 99495 may possibly be billed. If this visit occurs after the 14th day, utilize the appropriate level of evaluation and management service instead of a TCM code. If the patient meets the date criteria. The next decision to determining if a TCM code can be billed is based on the level of medical decision-making needed for the patient. Medical necessity cannot make up for a lack of documentation. And lots of documentation cannot make up for a lack of medical necessity. As with all things Medicare, medical necessity is the overarching criterion for payment of the service. Documentation and services provided determine the appropriate billing code. If documentation supports a moderate level of MDM, TCM code 99495 may be used. If documentation supports a high level of MDM, TCM code 99496 would be appropriate. Contact LVPG Compliance Education if you have any questions or would like more information on TCM services.